Now, according to United Nations Children's Fund, the global outbreaks of vaccine-preventable diseases are increasing, and that's putting at risk the lives of many children in many countries and also causing increased costs in response and treatment. Now, in the first 3 months of this year alone, more than 5,500 suspected cases of meningitis and nearly 300 deaths were reported in 22 countries, as well as measles and yellow fever, also showing increases across the African continent. Now, to highlight this, UNICEF, which is the World Health with the World Health Organization and GAVI, the Vaccine Alliance, have urged parents, the public, and politicians to strengthen support for immunization in their regions to prevent vaccine-preventable disease outbreaks. To talk to us more about this, we are joined now virtually by Doctor Paul Ngwakum, who is a regional health advisor for UNICEF for Eastern and Southern Africa. Dr. Ngwakum, thank you so much for your time and welcome to Morning Live.
Thank you very much for inviting me.
Dr. Ngwakum, so UNICEF has found increases in cases of meningitis, yellow fever and measles. Globally, this seems to be the trend, but also here on the African continent. What are some of the contributing factors to the growth in these infectious diseases that are, by the way, vaccine preventable?
Vaccine-preventable disease outbreaks are mostly due to a reduction in coverage of vaccination. And since the COVID-19 pandemic, there has been a big reduction in the coverage of vaccination globally and specifically on the African continent. And the main driver of vaccine-preventable disease outbreaks is zero-dose children. Zero-dose children, these are children who've never been vaccinated. And just so you know, in Eastern and Southern Africa, in 2023 alone, we documented 2.8 million children who are zero-dose. These are children who are not vaccinated, and they are not also having access to other basic social services. These are children that are found in the geographically hard-to-reach areas. These are children that are found in the urban slums. These are children that are found in areas that are affected by conflict. And if we don't reach these children, we will not be able to stop a propagation of vaccine-preventable disease outbreaks, not only on the continent, but globally.
So, Dr. Ngwakum, in that instance, how is UNICEF trying to reach those children? Because, as you say, the conditions in some instances may be absolutely treacherous. So, what are some of your programs to try and reach them?
I think what we have to look at is what are the drivers? What are the drivers of suboptimal immunization in our countries? Number one, we have to ensure that we work with governments to be able to invest in what is going to create the enabling environment for this vaccination. And that is in investing in primary health care, ensuring that we have the finances that are necessary to be able to procure the vaccines, support the micro-planning, support the logistics to take the vaccines to the difficult-to-reach areas, which I have listed before. Number two is about objectors. We are having so many objectors to immunization, some of them due to personal reasons, some of them due to socio-cultural reasons, some of them due to religious reasons. We have to work with context-specific actions, knowing what are the drivers for these communities to make sure that we convince them to be able to accept these immunization programs which we make available.
So that's an interesting point, because as you say, if you look, for example, at religious beliefs and in some instances misinformation as some of the reasons influencing vaccine hesitancy among some parents and caregivers that prevents them from having their children immunized. How is UNICEF engaging with those communities, with faith leaders or, other role players in this regard to make sure that you build trust then with those role players in order to encourage immunization?
I think this is a very uphill task when you're dealing with beliefs, some of them not linked to evidence, but linked to dogmatic kind of thinking. It's a big challenge, and that is why we're having these challenges. But we are working not only with the religious leaders, but also with the community leaders, with influential people in the community to be able to ensure that we pass the right message on what are the benefits of vaccination and what can go wrong when children don't get vaccination. And as you said, outbreaks. Outbreaks leads to disease, disease leads to death, and death leads to pain for the community. So these are kind of the interventions that we are doing. But as I said, we still need to do more.
And when we look at vaccine hesitancy, post-COVID, especially, Dr. Ngwakum, what sort of impact has that had on some of these outbreaks? And of course, again, the specific actions and impact on routine, what would have previously been routine childhood immunization?
Yeah, it is something serious, and that is why we are having these multiple outbreaks. Before COVID, of course, objectors have always existed, but this was exacerbated, as you may know, during the COVID-19 pandemic. And post-COVID, actions are still being taken forward to make sure that we convince and we make sure that these communities accept vaccination. But not only that, just convincing them alone is not enough. We have to ensure, and what we're doing, that we bring a package. When a woman brings the child for immunization, it's an opportunity to ensure that that woman has access to other services that are going to help her improve her well-being. If she needs antenatal care, we take care of that. If a child comes for immunization and that child needs to be screened for nutrition status. So to be able to ensure that we convince, we don't only send out information, but we accompany this by action. And this brings me back to what I think is very important by saying we bring in multi-sectoral approach to our interventions, which improves access and also helps also to contribute to convince the population to come for the uptake.
So are there any new technologies that you are using as UNICEF to try and improve that particular process or that sort of approach that you are using now?
But there are many. The world evolves every day, so we try to move with the times. Before the internet age, before the social media age, it was door to door and maybe using radio. But now there are many other platforms. Of course, we are using and exploiting these platforms. And I think we are also reaping fruits. If it's improving using social media, even using WhatsApp groups to be able to pass information. But at the same time, we also meet with challenges. Fake news, with free communication, you send out the right information and wrong information comes from other sectors as well.
So how do you deal with that? How do you counter that misinformation that is very easily spread nowadays through social media?
What we do is by building capacity of people in the community that are having good standing, which the community can trust. And that is why it's always good to work with community leaders, influencers in the community, and even the religious leaders themselves, because they're having opportunity and access to the population to be able to kind of provide them with the right information. But before doing that, it has to be context specific. We have to understand what are the key drivers. And the drivers in village A might be different from the drivers in village B. So that understanding of the community is also very important to be able to craft not only the right messages, but the right channels for transmission.
And that was going to be my very next question with regard to how you tailor the message, not just to be culturally specific, but also linguistically so, because I would imagine that in itself would be a mammoth task, Dr. Ngwakum.
That's correct. That's correct. We cannot go to a community that speaks basically Swahili, just for example, and you tailor information in English. That is not going to work. So this information is not only transmitted using the different channels, but we ensure that the language that is being used is a language that the community understands. And that's why we use community leaders, we use influencers, and people who are respected in these communities to be able to talk in the language that the community understands.
And what about funding at this stage? Because the world is in flux at the moment. There are so many geopolitical shifts. How has this impacted, the work that you're trying to do in getting children, by and large, to be immunized the world over?
You're very right. We are going through an unprecedented challenge in the global health financing. And I think, as you say, we have to come up with urgent mitigations to make sure that we don't do harm to the children. We don't cause a situation where we erode the gains that we've kind of accumulated over the years. And as UNICEF, we think this is also an opportunity to be able to work with governments, to be able to work with partners and think differently on how to move forward in financing the healthcare delivery, in financing immunization. And for that, our kind of advocacy is for governments to make the right choices. It's for governments to invest in interventions that are going to bring more dividends in terms of investing in, for example, primary healthcare.
And Dr. Ngwakum, staying with, the geopolitical situation, as you've said, there are children who are missing routine vaccinations due to the various reasons that you outlined at the start. And now we have areas that are war-torn, have been war-torn for many years. You've got the situation in Gaza, you've got the war in Ukraine, Sudan, just to name a few places like Haiti, where they've also just had instability for so long. Those children, do you have any sort of figures for how many of those children still need access to life-saving immunizations?
I think I will not be able to give you specific figures, but I just want to kind of insist or stress that these are one of the groups of children that we really need to craft interventions on how to reach them. Among the zero-dose children, we are having mostly children that are in the conflict-affected zones. And if we don't take care of these children, we will not be able to stop the multiple vaccine-preventable disease outbreaks.
And just a final question in terms of your fears, your main concerns at this stage, if this situation is not arrested?
We will be running through a risk of not only eroding the gains that we've accumulated over the years, we will be running a risk of putting our children at risk, and will not be able to meet neither the SDG goals of 2030 or the Agenda 2063, what we call the Africa we want. We will be derailed, we will not be able to meet these targets. It's an opportunity to be able to reflect, how can we do things differently? How can we anticipate to make sure that we take care of these challenges and continue to deliver for the children?
Well, Dr. Paul Ngwakum, thank you so much for your time this morning. Regional Health Advisor for UNICEF for Eastern and Southern Africa. Dr. Ngwakum talking to us about UNICEF, the World Health Organization, and GAVI, the Vaccine Alliance, urging parents, the public and politicians to come together to strengthen support for immunization in their different regions in order to prevent vaccine-preventable disease outbreaks such as measles, yellow fever, and meningitis.